This interview is brought to you by Nutanix. Nutanix makes extending to the public cloud simpler, faster, and more cost-effective by eliminating complicated application dependency mapping and refactoring. See how at nutanix.com/govcio.
We're sitting here at AWS Summit. I'm with Leith States, Chief Medical Officer at HHS, and also Acting Director of Science and Medicine. So nice to have you.
Pleasure. Thank you for having me.
So what are some of the biggest changes you're seeing in the tech industry that is really impacting the health landscape?
So I will date myself a bit. I'm now entering somewhere close to my 15th, 16th year in clinical medicine in the backdrop of military and federal service. So there have been different lenses that I've seen kind of disruptions in the healthcare industry. While they've all generally been disruptions leading towards end user convenience, customer service experience, patient empowerment, I think the most urgently disruptive has been not just AI and the emergence of it as a theoretical risk or opportunity, but now the scaffold being built around some at least executive order, congressional language, adoption of those principles within HHS and across interagency that's fueling a bit of the catalyst and kind of the urgency of the moment.
Absolutely. Things like AI, of course, and I'll get into that in a second. What are some of your top priorities for the coming year?
So the elephant in the room for me is always, as a senior career employee, is how to provide for continuity, how to maintain with minimal disruption across election seasons. So I'm keenly aware that right now we're sitting at the end of June, entering a very robust election period where the work doesn't stop, but certainly some of the external drivers and conditions affecting our work will change. So the idea for us is creating a sustainable environment where the good work continues and we continue to add value to our stakeholders. In many respects, those end up being individuals across the country, but in many other respects, they're advocacy groups, state, local, tribal, territorial organizations that serve as partners with us in some fashion, and in other respects as advocates telling us when things aren't going quite right or where we're missing the mark in understanding the landscape we're operating in. So that's kind of the top of mind, elephant in the room priority for me. The other pieces are just to ensure good stewardship of existing resources. We're in the tail end of what was a very contentious fiscal year 2024, not unlike fiscal year 2023 and 2022 and 2021 and 2020. So operating on a series of continuing resolutions ends up in a situation where we have unpredictable or unmet funding needs over the course of the year, and we just continue to pivot as money hits our funding cans. So as opportunity presents itself, we just have to be ready to move forward and obligate money. So that's the other concern going into the rest of the year.
Okay. A big priority for HHS as overall is really driving home this health equity by design concept.
Right.
How are you seeing this play out in public health, or I guess in the programs that you're involved in?
Well, so I'll step back to give a longer lens perspective. Yes, health equity by design has been important for the last 3 years, specifically this administration, but over time, and we might look back more than 20 years ago, where we started to have the introduction of thoughts and understandings around, the beginnings of the environmental justice movement, social determinants of health, these economic and other drivers of health inequities and access, where we all were generally speaking towards similar ideas, but maybe not with precise language. And even now, as health equity and that intentionality has started to take a more prioritized look from top-down leadership, we still don't necessarily understand how to do it well. So even though we say something like health equity by design, that's a nebulous kind of vague term, right? So does it mean we have, we've changed our systems, practice, policies, or to support representation, to support access, to support the idea of equity in all its forms? Or is it as an afterthought? Is it as just to pay lip service to the concept, to the idea, to a constituency, to placate? And I think we're doing the former in terms of trying to identify sustainable ways that do really add value and add that capacity to clarify the ground in which we're operating. Because many times we just run to solutions and don't take a thoughtful approach to why we're doing what we're doing or how we should be most effectively doing it to work with our advocates and partners, as opposed to just doing what we think is the best response.
Absolutely. Is this approach kind of manifesting in any way in some of the technologies that you see really?
Yeah, actually, it's been quite interesting to see how there's been a pivot in working towards those ideas around ethical implications of data acquisition, data analysis, data interoperability, patient empowerment and transparency in data, that is allowing for what I'm starting to see is a building platform that's allowing our Office of the National Coordinator for Health IT to maybe take a leadership role where they had not been empowered to do so in the past. Some of that is being enabled by generative AI, large language models and machine learning, and the understanding that the conditions are now such that a lot of the promise of ONC, a lot of the promise of USCDI, of health information exchanges to do better with the data we have is now actually tangible, as opposed to just a pipe dream or something to aspire to. So I think that's probably the thing that most strikes me at HHS in terms of where we're at.
Absolutely. And I know that those standards and some of the frameworks around those have seen a lot of development over the past year alone. So it's exciting to see where that's going.
Yeah.
So what do tech providers need to know about health equity by design, considering your perspective on it? I guess what would you tell them?
So the one thing I'll say is, design devoid of representation, understanding of the community you're attempting to serve will always end up missing the mark. So as designers, as innovators, as folks working in this space to create something where there has not been something before, if there is not that intentionality to work with communities, and I'm not saying that this is all community-based organizations, but at QHCs, health systems, insurers, payers, the whole mix of public health and population health along with clinical systems, there's going to be something that's not quite hitting the mark. And this is where I think there's a lot of interesting, unique opportunity where outside entities can partner with the government in providing safe places to work through the thorny issues of AI, to actually create spaces where we can work together and do it in a space that allows that data share and that shared understanding to come out.
Sure. Okay. So what are you looking forward to engaging more about the community about, especially being here at AWS Summit?
So as someone that is a preventive medicine physician, that is not a health data person, that is not an informatician, that has a high touch on these issues, but is not the expert by any means, I like being in a situation where I'm being fed, where I can learn and understand and get a practical realization of what the constraints, restraints, opportunities, and risks are for this landscape that we're operating in. And it's always a great compliment to the work that we're doing at HHS when I've been able to work alongside individuals within our AI task force or within our, Office of Chief Data or Chief Technology, Chief Information. There are certain lessons learned where I can apply my perspective across a variety of these areas that get informed from the experts. So I enjoy learning and being part of the mix here as much as anything else. I put on my hat to present for a little bit, understanding that, I certainly am in a place of receipt more than giving.
Well, thanks so much for catching up with me. This is great.